Hey everyone, welcome back for another deep dive with us. Today we're going deep into the world of muscle pain.
Oh.
But not just any muscle pain. We're talking about myofascial pain and dysfunction.
Right.
And to help us navigate this tricky terrain, we've got excerpts today from Travel Simons and Simon's Myofascial Pain and Dysfunction, the trigger point manual.
Yeah.
It's like the encyclopedia on this topic.
Like a Bible.
So are you ready to jump in and see what we can uncover about these mysterious trigger points?
Absolutely. I think it's a fascinating area. So many people suffer from muscle pain and just don't really understand what's going on. And trigger points are often the culprit.
So let's start with the basics. What exactly are trigger points?
Well, you can think of them as these hyper-irritable spots in your muscles.
Oh, okay.
They're basically like little knots that can cause a whole lot of trouble.
So like those knots I always feel in my shoulders.
Exactly.
Could those be trigger points?
Absolutely. They could be. And the thing is, there are actually two types of trigger points.
Oh.
You've got latent trigger points.
Okay.
And you've got active trigger points. The latent ones are way more common, but they're kind of sneaky.
Right.
They might cause stiffness or limited movement, but not always direct pain.
Interesting.
It's like a tension headache waiting to happen.
Okay.
But then you have the active trigger points. Those are the ones that cause immediate spontaneous pain right where they are.
Ouch.
Yeah, exactly.
So if I'm feeling stiffness in my neck, but not necessarily pain, I could still have a trigger point lurking there.
Absolutely. And here's where things get really interesting.
Oh, boy.
Trigger points can also cause what we call referred pain.
Referred pain.
Yeah. And this means a trigger point in one muscle can actually cause pain in a completely different area.
Oh, wow. So that's why sometimes it's so hard to pinpoint where the pain is actually coming from.
Precisely. It's one of the reasons myofascial pain can be so tricky to diagnose. But once you understand those patterns, it can be like a light bulb moment.
I like light bulb moments.
Yeah, me too.
Okay, so we know what trigger points are, but how do they actually form in the first place?
Oh, that's the million-dollar question.
Yeah.
And the current thinking revolves around something called the integrated trigger point hypothesis. It's a bit of a mouthful.
It is, yeah.
But to put it simply, imagine your muscle fibers are like a clenched fist.
Okay.
In a trigger point, that fist gets stuck in the clenched position.
Gotcha.
And this is partly due to an excess of acetylcholine.
Acetylcholine.
Yeah, that's a chemical messenger that tells your muscles to contract.
Okay.
It's like the messenger gets stuck on repeat, constantly telling the muscle fibers to clench.
So it's not just that the muscle is tight. There's actually this constant signal telling it to stay contracted.
Yes, exactly.
Yeah.
And there's another element to this, calcium ions. These ions are vital for muscle contraction. But in trigger points, they seem to get trapped within the muscle fibers, further contributing to that constant state of contraction.
So it's like a double whammy.
It really is.
The excess acetylcholine and the trapped calcium ions, both contributing to that clenched fist.
Precisely.
Now, you mentioned this is a hypothesis.
Right.
So does that mean we're still not entirely sure what causes trigger points?
You're right. Research is ongoing.
Okay.
And remember, pain is always a complex experience.
Right.
It's not just about what's happening in the muscles, but also how our nervous system processes those signals.
That makes sense.
Yeah.
And speaking of the nervous system, we got to talk about nociception and central sensitization.
Yeah, those are big words.
They are.
Important concepts, though.
Right.
Nociception is essentially how our body senses pain.
Okay.
It involves specialized nerves called nociceptors.
Nociceptors.
Yeah, they detect painful stimuli and send signals to the brain.
So when you stub your toe, those nociceptors are firing off out signals.
Exactly.
Makes sense.
But with central sensitization,
Right.
it's like the volume control on those pain signals gets turned way up.
Oh, so even a light touch could feel incredibly painful.
Exactly.
Yeah.
The nervous system becomes overly sensitive to pain signals.
Yeah.
Even after the initial injury has healed.
Wow.
And you know what's really fascinating?
What's that?
Trigger points can actually contribute to central sensitization.
Really?
Yeah, that constant barrage of pain signals from the trigger point can wind up rewiring the nervous system to be more sensitive to pain in general.
So it's like a vicious cycle.
It really is.
These trigger points are constantly sending pain signals, and those signals can actually change how our nervous system perceives pain, making us more sensitive.
Yeah, it's a tricky situation.
It is. Yeah. But the good news is understanding this cycle is key to finding effective treatment strategies.
Absolutely.
That's what I want to hear. But first, what are some of the things that can actually cause these trigger points to form or worsen?
Well, I'm guessing slouching over your computer all day isn't helping, right?
You got me there.
Yeah. Postural issues like slouching are definitely a common culprit,
Okay.
but it's not just about posture.
Right.
Any kind of muscle overload can contribute,
Yeah.
whether it's repetitive motions at work
Right.
or even sudden, intense exertion like lifting something too heavy.
So basically anything that puts excess stress on those muscles.
Exactly. And I imagine psychological stress plays a role too.
Oh, absolutely.
Oh.
I know when I'm stressed, my shoulders are practically up by my ears.
A perfect example.
Yeah.
Stress hormones can actually increase muscle tension, making us more prone to developing trigger points.
So it's a mind-body connection.
It really is.
Yeah.
And there are other factors that can contribute, like hormonal imbalances
Hmm.
and nutritional deficiencies.
Interesting.
Estrogen fluctuations can affect pain sensitivity,
Mhm.
and deficiencies in vitamin D and magnesium can also play a role.
So it's really about taking a holistic view of our health, understanding all these different factors that can contribute to myofascial pain.
Precisely, it's not just about treating the symptoms, but addressing the underlying causes.
Now let's get to the part I'm really curious about, treatment options.
Okay.
What can we actually do to get rid of these trigger points and find some relief?
Well, one of the key approaches is manual therapy.
Manual therapy.
Yeah, this includes techniques like massage stretching and trigger point release therapy, where a therapist applies pressure to the trigger point to release the tension.
So that's where the hands-on approach comes in.
Right.
But it's not all passive, right?
Yep.
I imagine movement and exercise are important too.
Absolutely, you're right. Movement is crucial. We need to retrain those muscles, strengthen them, and correct any faulty movement patterns that may be contributing to the problem.
So it's about combining those hands-on therapies with active self-care.
Exactly.
What about posture? Any tips for those of us who spend hours at a desk?
Well, ergonomics are key. Make sure your workstation is set up to support good posture.
Right.
And remember to take breaks to stretch and move around regularly.
Set a timer, stand up every hour, stretch it out. Got it. What about lifestyle changes?
Yeah.
Are there any specific things we can do in our daily lives to prevent or manage trigger points?
Definitely getting enough sleep, managing stress levels,
Okay.
and addressing those nutritional deficiencies we talked about can make a big difference.
It seems like it's not just about what we do in a therapist's office, but about making sustainable changes to our habits and how we care for our bodies.
That's the ultimate goal. And in some cases, psychological support can be helpful too, especially for those dealing with chronic pain.
That makes sense. Now, before we move on to specific muscles and their referred pain patterns,
Okay.
I have to ask about dry needling. It seems to be a popular treatment these days. Is it effective for trigger points?
Dry needling can be very effective,
Yeah.
but it's essential to find a qualified practitioner.
Okay.
It involves inserting thin needles directly into trigger points
Oh.
to release the tension and reduce pain.
So it's not the same as acupuncture.
No. While they both use needles, dry needling is based on Western anatomical principles
Okay.
and specifically targets trigger points.
Good to know. Now, I'm ready for the mind-blowing part, those referred pain patterns.
Okay.
You mentioned some surprising connections earlier.
Absolutely. Are you ready to dive into some specific muscles?
Yeah.
And see how they can cause pain in unexpected places?
I'm all ears. Let's start with the levator scapulae. I have to admit, I'm not even sure where that one is.
It's a muscle in your upper back and neck that helps elevate and rotate your shoulder blade.
Okay.
But here's the wild part. Trigger points in this muscle can cause pain in your neck, upper back, and even up into your head.
So that tension headache I get could actually be coming from my shoulder blade.
It's entirely possible.
Wow.
And that's just one example. Another muscle, the sternocleidomastoid,
Okay.
which runs along the side of your neck, can contribute to dizziness, headaches, and even ear pain.
Wait, ear pain from a muscle in my neck.
You heard that right. These referral patterns can be really surprising.
Yeah.
Trigger points can cause a cascade of seemingly unrelated symptoms.
It's amazing.
It is. Let's talk about another muscle that's often overlooked, the masseter.
Master's something to do with chewing.
Exactly. It's one of your main chewing muscles.
Okay.
But trigger points in the masseter can cause jaw pain, earaches, and even toothaches.
So that nagging toothache I've been ignoring could actually be a muscle problem.
It could be.
This is incredible. Any other examples of muscles with these surprising referral patterns?
Oh, there are so many. Take the digastric muscle, for example. It's a small muscle located under your jaw.
Okay.
But trigger points in this muscle can refer pain as far as the eye and ear. And then there's the subscapularis, one of the rotator cuff muscles.
Okay, I'm starting to think I need a diagram to keep track of all these muscles.
Yeah, it can be a lot to take in.
What about the subscapularis? What kind of pain can that cause?
Well, trigger points in the subscapularis can actually mimic symptoms of frozen shoulder.
Oh, wow.
And they can even refer pain all the way down to your wrist.
Wrist pain from a muscle in my shoulder. Okay, my mind is officially blown. I think we need to take a little break to let all this sink in. We'll be back with more fascinating insights into those sneaky trigger points and their surprising pain patterns. All right, we're back and ready to uncover even more mysteries of these trigger points and their crazy referral patterns.
Yeah, we've only just scratched the surface. There's a whole world of muscles out there causing all sorts of trouble.
I'm intrigued. Let's dive in. What other muscles should we be on the lookout for?
Well, let's talk about another shoulder muscle, the infraspinatus.
Infraspinatus. Okay, I'm not sure I'm familiar with that one.
It's part of the rotator cuff located on the back of your shoulder blade.
Okay, vaguely familiar with the rotator cuff.
Right. So trigger points in the infraspinatus can cause that deep aching pain in the back of your shoulder that many people experience.
Oh, I know that pain.
Yeah, we all do. And get this, the pain can even radiate down the arm, sometimes mimicking a pinched nerve.
Oh, wow, so it can really throw you off.
It's like a pain chameleon, making it even harder to figure out what's really going on.
That's why it's so important to see a skilled practitioner who can really sort through all that.
Absolutely. You need someone who can differentiate between these various types of pain and pinpoint the true culprit.
Right. Okay, so we've got the infraspinatus. What about the teres minor? Is that another shoulder muscle we should be aware of?
It is, and it often works together with the infraspinatus. Trigger points in the teres minor can also cause pain in the back of the shoulder.
Okay.
But the referred pain tends to travel more towards the outside of the arm.
So if the pain is in the back of my shoulder but shooting down the outside of my arm, that could be the teres minor acting up.
It's a strong possibility, but remember, everyone's pain patterns are unique.
Right.
So a proper diagnosis is always the best way to go.
Makes sense. Okay, I'm starting to feel like a myofascial pain detective.
I like it.
I'm ready to solve the mystery of my own aches and pains.
Now, let's shift gears a bit and talk about a muscle that's often involved in low back pain.
Okay.
The latissimus dorsi.
Latissimus dorsi. Wow, that sounds impressive.
It is a pretty impressive muscle. It's actually the largest muscle in your back.
Okay.
And it plays a role in lots of movements.
Right.
But when it comes to trigger points, this muscle can cause referred pain to the mid-back shoulder blade and even down the arm.
Hold on. So that nagging pain in my mid-back that I've always blamed on bad posture could actually be coming from my latissimus dorsi.
It's definitely within the realm of possibility, and here's another surprising connection.
Okay.
Trigger points in the latissimus dorsi can mimic symptoms of angina.
Angina, you mean chest pain?
Yes, it can feel like a tight band around your chest, making it difficult to take a deep breath.
This is wild. So many seemingly unrelated symptoms.
I know, it's fascinating, isn't it?
It is. It really is. It's like a whole new way of looking at the body.
That's what's so fascinating about this deep dive. It's all about making these connections and understanding the intricate ways our bodies work.
I'm totally hooked. What other back muscles should we be on the lookout for?
Well, the trapezius is a big one.
Trapezius? Oh, yeah, I know that one.
It's actually divided into 3 parts, upper, middle, and lower.
Right.
And each part has its own unique referral pattern.
Oh, that makes it even more complex.
It does. So trigger points in the upper trapezius can refer pain to your neck, shoulders, and even up the back of your head, causing headaches.
So you're telling me that tension headache I always get could be coming from my trapezius.
It's certainly possible, and trigger points in the middle trapezius can cause pain between the shoulder blades.
Ugh, I definitely get that after a long car ride.
Yeah, and then there's the lower trapezius,
Right.
which can refer pain to your mid-back and even wrap around your chest.
So the trapezius is like a pain referral machine.
It can be, especially if it's overworked or under a lot of stress.
Okay, I'm definitely going to be paying more attention to my trapezius. From now on, are there any other back muscles we should add to our list?
The rhomboid muscles are often involved in upper back pain as well.
Rhomboids, those are new to me. Where are they located?
They sit between your shoulder blades and help to retract them, pulling them together.
Okay, I think I can feel them now. What kind of pain do they cause?
Trigger points in the rhomboids can cause that deep aching pain between the shoulder blades.
Right.
And they can also refer pain to the shoulder and even down the inside of your arm.
So if the pain is between my shoulder blades but traveling down the inside of my arm, that could be the rhomboids.
That's a good starting point. But as always, we have to consider other potential causes as well.
Okay, getting the hang of it. It's all about those referral patterns.
Exactly. The more you understand these patterns, the better prepared you'll be to advocate for your own health and find effective treatment strategies.
This is amazing. We've covered so much ground already, but I'm guessing there are even more fascinating muscles and referral patterns to explore, right?
Oh, absolutely. We've only just begun to explore the vast world of myofascial pain.
Well, I'm ready to keep exploring. Let's delve into some more of these muscle mysteries and see what other surprises we can uncover.
Okay, so we're back, and my mind is officially blown after all those crazy referral patterns.
Yeah, we really have just scratched the surface. There are so many more muscles and referral patterns to explore.
Well, bring it on. I'm ready for more. What else you got?
Let's talk about a group of muscles that often fly under the radar, the scalenes.
Scalene's okay. Not ringing a bell.
They're located deep in your neck on either side of your voice box.
Okay, so not muscles we think about every day.
Right, but they can cause a lot of trouble, especially if they're full of trigger points.
Like what kind of trouble?
Well, for one thing, the scalenes are notorious for mimicking the symptoms of thoracic outlet syndrome.
Thoracic outlet syndrome. That sounds serious.
It can be. It's a condition where nerves and blood vessels in the space between your collarbone and first rib get compressed.
Oh, wow.
This can cause pain, numbness, tingling in your arm and hand.
So you're saying the scalenes can cause those symptoms even if there's no actual compression? Exactly. Tight trigger point filled scalenes can put pressure on those structures, creating the same symptoms as true thoracic outlet syndrome.
So it's like a false alarm.
In a way, yes.
So if I'm experiencing those symptoms, I really need to get a proper diagnosis.
Absolutely. You want to rule out any other underlying issues.
Right. Okay, so we've got the scalenes, those sneaky little neck muscles. What's next?
Let's move on to a muscle that's a real pain in the neck, literally speaking.
Oh, I think I know this one, the sternocleidomastoid.
You got it. We touched on it earlier.
Yeah.
But it's worth revisiting. This muscle is so often involved in neck pain and headaches.
And you said it can cause dizziness and ear pain, too.
That's right. And to add to the list,
Oh, boy.
trigger points in the sternocleidomastoid can also contribute to jaw pain and even TMJ problems.
Wow, this muscle is like the overachiever of pain.
It really is.
What makes it so prone to developing trigger points?
Well, it's often overworked, especially if we have poor posture or spend a lot of time looking down at our phones.
Okay, I'm making a mental note to hold my head up high from now on.
Good idea.
Any other muscles we should be aware of when it comes to neck pain?
The suboccipital muscles are often culprits as well.
Suboccipital muscles? That sounds a little intimidating.
They're actually a group of 4 small muscles located at the base of your skull.
Oh, okay, so those are the ones that really get tight when you have a tension headache.
Exactly. Trigger points in these muscles can cause pain in the back of your head, your neck, and even up into your forehead.
It's like the trifecta of headache pain.
It can be, and they can also contribute to dizziness and balance problems.
Wow, these little muscles really pack a punch.
They do, and they're often overworked, especially if we spend a lot of time sitting at a desk or looking at screens.
Okay, I'm definitely going to be taking more breaks to stretch and move around from now on. My neck and head will thank me. It's amazing to think that something as simple as a tight muscle can cause so many different problems. We've talked about neck pain, headaches, ear pain, even chest pain. What about the face? Can muscles in the face have trigger points too?
Absolutely. They can harbor trigger points just like any other muscle in the body. For example, trigger points in the frontalis, which is your forehead muscle, can contribute to tension headaches.
So if I'm furrowing my brow in concentration, I could actually be setting myself up for a headache.
It's definitely possible. And trigger points in the temporalis muscle,
Okay.
which is one of your chewing muscles, can cause pain in your temples and even behind your eyes.
So all that time I spend staring at a computer screen could be contributing to trigger points in my jaw muscles.
It's definitely something to consider. It's fascinating how everything is interconnected, isn't it?
It really is. It's like our bodies are these complex webs of muscles and nerves all influencing each other.
That's a great way to put it, and that's why a holistic approach to treatment is so crucial.
Yeah.
It's about addressing all these different factors, the muscles, the nerves, the lifestyle habits to find lasting relief.
Okay, so we've covered a lot of ground today. We've talked about what trigger points are, how they form, what causes them, and even some of the surprising ways they can refer pain throughout the body. Any final words of wisdom for our listeners before we wrap up?
My biggest piece of advice would be to remember that knowledge is power. The more you understand about your body and the potential causes of your pain, the better equipped you'll be to advocate for your own health.
I love that.
Don't be afraid to ask questions, explore different treatment options, and find a healthcare team that listens to you and supports your journey toward pain relief.
Such great advice. It's so empowering to understand what's going on in our bodies and to know that we have options when it comes to finding relief.
Absolutely. And remember, you don't have to suffer in silence.
Yes.
Myofascial pain is incredibly common, and there are effective treatments available, so pay attention to your body, listen to those aches and pains, and take action to reclaim your well-being.
Wonderful advice. Thank you so much for joining us for this fascinating deep dive into the world of myofascial pain. I know I've learned a ton, and I hope our listeners have too. Until next time, stay curious and take care of yourselves.